Medical Assistant Exam Patient Education Review. Question 1. In a community health clinic, a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A. Remove the band so it does not worry the patient. Option B. Give medication first and ask about allergies later. Option C. Ignore the band if the patient seems healthy. Option D. Verify the allergy information in the record and with the patient. The correct answer is option D. Verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Removing an alert without direction can create risk. Allergies must be checked before administration. Allergy risk is not based on appearance. Question 2. Before the visit continues in a medication administration visit, the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A. The oral temperature will decrease. Option B. The pulse oximeter will stop working. Option C. The reading may be inaccurate. Option D. The patient will automatically faint. The correct answer is option C. The reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Cuff placement does not change oral temperature. Blood pressure cuff alignment does not control the pulse oximeter. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Question 3. At the start of care in a specialty referral visit, the assistant removes soiled dressings from a wound. Which practice is appropriate? Option A. Use gloves and dispose of the dressing according to biohazard policy. Option B. Save the dressing in the patient's purse. Option C. Handle the dressing with bare hands. Option D. Place the dressing on the clean supply tray. The correct answer is option A. Use gloves and dispose of the dressing according to biohazard policy. Soiled dressings can contain blood or body fluids and require barrier protection and proper disposal. Biohazard waste should not be sent home in personal belongings. Bare hand contact increases exposure risk. Soiled material can contaminate clean supplies. Question 4. To protect safety in an electronic health record review, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A. Leave the wheelchair unlocked for easier movement. Option B. Ask the patient to jump to the table. Option C. Pull the patient by the arms quickly. Option D. Lock the wheelchair and use proper body mechanics with assistance as needed. The correct answer is option D. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. An unlocked wheelchair can roll and cause a fall. Jumping is unsafe and unrealistic for a transfer. Pulling can injure the patient and the assistant. Question 5. When a patient encounter unfolds in a clinical skills review, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A. Give the patient food to push it down. Option B. Perform blind finger sweeps immediately. Option C. Encourage coughing and monitor closely. Option D. Leave the patient alone until they stop coughing. The correct answer is option C. Encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. Food can worsen the obstruction. Blind finger sweeps can push the object deeper and are not appropriate. The patient should be monitored because the obstruction may worsen. Question 6. In an urgent care office, a patient questions a medication that looks different from the usual dose. Which response is safest? Option A. Pause administration and verify the order and medication. Option B. Document that the patient was difficult and continue. Option C. Give the medication quickly before the patient refuses. Option D. Tell the patient that questions are not allowed. The correct answer is option A. Pause administration and verify the order and medication. A patient concern can identify a potential medication error, so verification is required before proceeding. Labeling the patient does not resolve the possible medication issue. Rushing increases risk and ignores a safety concern. Patients should be encouraged to participate in safety. Question 7. During a diagnostic testing area, a patient develops hives, wheezing, and swelling after an injection. Which action is most appropriate? Option A. Ignore the symptoms if the injection site looks clean. Option B. Tell the patient to drive home and rest. Option C, schedule a routine follow-up for next week. Option D, notify the provider and activate emergency protocol immediately. The correct answer is option D, notify the provider and activate emergency protocol immediately. These findings can indicate anaphylaxis and require urgent response. Systemic allergic symptoms matter even if the injection site appears normal. Respiratory symptoms and swelling require immediate attention. Potential anaphylaxis cannot be delayed for routine follow-up. Question 8. When a patient encounter unfolds in a certification exam scenario, blood spills on an exam room floor, which response follows standard safety practice? Option A, use appropriate personal protective equipment and an approved disinfectant. Option B, wipe the spill with a dry paper towel only. Option C, ask a patient to avoid stepping on it. Option D, cover the spill with an exam table paper. The correct answer is option A, use appropriate personal protective equipment and an approved disinfectant. Blood spills require barrier protection and a disinfectant suitable for bloodborne pathogen cleanup. Dry wiping can spread contamination and does not disinfect the surface. Patients should not be involved in hazardous cleanup. Covering a spill does not remove or disinfect the hazard. Question 9. Given the workflow in an electronic health record review, a patient asks for a copy of their medical record. Which action should the assistant take? Option A, refuse because records belong only to the provider. Option B, delete sensitive information before the request is reviewed. Option C, give the record to anyone who asks. Option D, follow the office release of information process. The correct answer is option D, follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Patients have rights to access their health information under applicable rules. Altering the record is inappropriate and may violate legal requirements. Identity and authorization must be verified before disclosure. Question 10. In a procedure setup, the assistant removes gloves after contact with blood-contaminated gauze. Which action should follow immediately? Option A, perform hand hygiene. Option B, place the gloves in a regular drawer. Option C, use the same gloves to clean the next room. Option D, apply lotion instead of cleaning hands. The correct answer is option A, perform hand hygiene. Hand hygiene after glove removal reduces the chance of transmitting microorganisms from contaminated gloves. Used gloves are contaminated waste and should be discarded properly. Gloves are task-specific and should not be reused between patients or areas. Lotion does not replace hand hygiene. Question 11. The care team in a cardiology practice asks for guidance because a tourniquet has been in place for more than 1 minute before venipuncture. Which action is safest? Option A, move it over the venipuncture site. Option B, tighten it further until the vein bulges. Option C, release it and allow the arm to recover before continuing. Option D, ignore the time because tourniquets do not affect tests. The correct answer is option C, release it and allow the arm to recover before continuing. Prolonged tourniquet time can cause hemoconcentration and affect test results. A tourniquet is placed above the site, not over the puncture area. More pressure can increase discomfort and alter specimen quality. Tourniquet time can affect certain laboratory values. Question 12. An office review in a diagnostic testing area shows that the abbreviation NPO appears before a procedure. Which instruction does it represent? Option A, nothing by mouth. Option B, nasal passage open. Option C, new patient only. Option D, normal pulse output. The correct answer is option A, nothing by mouth. NPO means the patient should take nothing by mouth for the specified period. NPO is not a nasal assessment abbreviation. New patient only is not the meaning of NPO. NPO does not describe pulse measurement. Question 13. An office review in a busy front office shows that a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A, a normal calibration mark only. Option B, a properly grounded machine with still patient. Option C, correct limb lead placement. Option D, poor electrode contact or patient movement. The correct answer is option D, poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Calibration marks do not explain baseline movement during tracing. Good grounding and stillness reduce electrical or motion artifact. Correct placement should reduce rather than create artifact. Question 14. Following office protocol in a same-day appointment, a patient has been drinking hot coffee immediately before an oral temperature. Which action should the medical assistant take? Option A. Switch to a rectal temperature without asking. Option B. Wait according to office protocol before measuring the oral temperature. Option C. Record the temperature as normal without measuring it. Option D. Take the temperature immediately because oral readings are unaffected. The correct answer is option B. Wait according to office protocol before measuring the oral temperature. Hot or cold intake can temporarily alter oral temperature and lead to an inaccurate reading. Changing to an invasive route requires proper indication and protocol. Vital signs must be measured rather than assumed. Recent liquids can affect oral temperature results. Question 15. Before the visit continues in a preventive care visit, the assistant scans a signed consent form into the wrong patient's chart. Which action is best? Option A. Delete the form and tell no one. Option B. Report and correct the filing error according to policy. Option C. Ask the patient to sign a blank form. Option D. Leave it because both patients use the same clinic. The correct answer is option B. Report and correct the filing error according to policy. Misfiled records can affect patient care and privacy, so they must be corrected properly. Unreported deletion can worsen the documentation error. Blank forms do not correct the misfiled record and are inappropriate. Clinic use does not make one patient's document appropriate in another chart. Question 16. After reviewing the situation in an outpatient laboratory, a patient asks for a diagnosis based on symptoms described during intake. Which response is appropriate? Option A. Give a diagnosis to save time. Option B. Document the symptoms and tell the patient the provider will evaluate them. Option C. Tell the patient to search the internet for a diagnosis. Option D. Ignore the symptoms because they are subjective. The correct answer is option B. Document the symptoms and tell the patient the provider will evaluate them. Medical assistants collect information and support workflow, while diagnosis is the provider's responsibility. Diagnosing is outside the medical assistant scope. Unguided self-diagnosis can be inaccurate and unsafe. Reported symptoms are relevant and should be documented. Question 17. A medical assistant is working in a diagnostic testing area when a patient becomes angry about a long wait time. Which response is most appropriate? Option A. Ignore the patient until the appointment starts. Option B. Acknowledge the frustration and provide a realistic update. Option C. Blame the provider in front of the patient. Option D. Tell the patient to calm down or leave. The correct answer is option B. Acknowledge the frustration and provide a realistic update. Empathy and accurate information can de-escalate frustration while maintaining professionalism. Ignoring frustration often makes the situation worse. Blaming coworkers is unprofessional and does not solve the issue. Commands can escalate conflict and harm patient rapport. Question 18. While working in a diagnostic testing area, a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A. Notify the provider or designated clinical staff promptly. Option B. File the result for review at the end of the month. Option C. Tell the patient the exact diagnosis without provider review. Option D. Discard the result because it is abnormal. The correct answer is option A. Notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Delaying a critical result can put the patient at risk. Diagnosis and interpretation belong to the provider. Abnormal results must be reported, not discarded. Question 19. While working in a procedure setup, a patient falls in the exam room. Which action is best? Option A. Hide the incident if no one saw it. Option B. Pull the patient up immediately. Option C. Tell the patient to drive home without evaluation. Option D. Call for help and assess for injury before moving the patient. The correct answer is option D. Call for help and assess for injury before moving the patient. After a fall, unnecessary movement can worsen injury, so help and assessment come first. Falls must be reported and documented according to policy. Moving the patient before assessment can worsen an injury. The patient should be assessed before leaving. Question 20. A medical assistant is working in an infection control audit when a new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A, remove allergies that the patient says happened many years ago. Option B, place the form in the chart without reviewing it. Option C, ask the patient to remember only prescription allergies. Option D, verify the allergy information and enter it clearly in the medical record. The correct answer is option D, verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Past reactions may still be clinically important and should not be deleted without provider direction. Important safety information can be missed if the history is not reviewed. Allergies to over-the-counter drugs, foods, or latex may also affect care. Question 21. When a patient encounter unfolds in a patient education session, a provider needs the head of the exam table raised for a patient with breathing difficulty. Which position may be helpful? Option A, prone position. Option B, Fowler position. Option C, lithotomy position. Option D, Trendelenburg as the only routine choice. The correct answer is option B, Fowler position. Fowler position raises the head and upper body, which can ease breathing for some patients. Prone places the patient face down and may worsen breathing comfort. Lithotomy is used for pelvic procedures and does not primarily support breathing. Trendelenburg lowers the head and is not the usual comfort position for breathing difficulty. Question 22. An office review in a quality control review shows that a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A, use the disinfectant only on clean hands. Option B, dilute the solution more to reduce odor. Option C, keep the surface wet for the full listed contact time. Option D, wipe the surface dry immediately. The correct answer is option C, keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Environmental disinfectants are not hand hygiene products. Unapproved dilution can reduce disinfectant strength. Removing the disinfectant too soon can make it ineffective. Question 23. While working in an internal medicine office, a medical assistant performs a procedure without patient permission. Which legal concern may apply? Option A, defamation. Option B, emancipation. Option C, coordination of benefits. Option D, battery. The correct answer is option D, battery. Battery can involve intentional touching or treatment without consent. Defamation involves false statements that harm reputation. Emancipation relates to a minor's legal independence. Coordination of benefits is an insurance concept. Question 24. Following office protocol in a patient education session, a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A, place the probe over wet nail polish. Option B, warm the finger or choose a better perfused site. Option C, ignore the waveform and record the lowest value. Option D, increase oxygen without reporting the finding. The correct answer is option B, warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. Moisture and polish can interfere with sensor performance. An unstable signal should be corrected before documenting the value. Medication or oxygen changes should follow provider direction and clinical protocol. Question 25. After reviewing the situation in a patient education session, a multi-dose vial has no date after being opened. Which action is most appropriate? Option A, use it because the cap is still attached. Option B, follow facility policy and do not use it if safety cannot be verified. Option C, guess the opening date from memory. Option D, mix it with another vial to avoid waste. The correct answer is option B, follow facility policy and do not use it if safety cannot be verified. Opened multi-dose vials require proper dating and storage to support medication safety. The cap does not prove when the vial was opened or whether it was stored correctly. Guessing creates unsafe documentation. Combining vials can contaminate medication and is not appropriate. Question 26. Before the visit continues in an urgent care office, a patient asks for printed medication instructions. Which practice improves health literacy? Option A, use clear language and review the key points with the patient. Option B, tell the patient to search online without guidance. Option C, use only complex medical terminology. Option D, provide instructions in the wrong language. The correct answer is option A. Use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Unguided online searching may provide inaccurate or confusing information. Complex terms can reduce comprehension. Language mismatch can prevent safe understanding. Question 27. At the start of care in a telephone triage workflow, the QRS complex is reviewed on an electrocardiogram. Which event does it mainly represent? Option A, ventricular depolarization. Option B, lung gas exchange. Option C, ventricular filling with blood only. Option D, atrial repolarization only is the visible main event. The correct answer is option A, ventricular depolarization. The QRS complex represents electrical activation of the ventricles. Gas exchange occurs in the alveoli, not on the QRS waveform. Mechanical filling is not the primary electrical event represented by QRS. Atrial repolarization is usually hidden within the QRS complex. Question 28. Before the visit continues in a medication administration visit, the provider requests an adult radial pulse during intake. Which technique should the medical assistant use? Option A, place 2 or 3 fingers over the radial artery at the wrist. Option B, use the thumb to feel the pulse. Option C, count respirations before locating the pulse. Option D, place the stethoscope over the abdomen. The correct answer is option A, place 2 or 3 fingers over the radial artery at the wrist. The radial artery at the thumb side of the wrist is commonly used for an adult pulse. The thumb has its own pulse and can interfere with accurate counting. Respirations are measured separately and do not identify the pulse site. The abdomen is not used for a routine radial pulse. Question 29. While working in a quality control review, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A, schedule the patient for next month. Option B, give a diagnosis over the phone. Option C, follow emergency triage protocol immediately. Option D, tell the patient to send an email later. The correct answer is option C, follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Routine scheduling can delay care for potentially serious symptoms. Medical assistants should not diagnose the cause of symptoms. Potential emergencies require immediate action. Question 30. Following office protocol in a busy front office, a peak flow test is ordered. Which body system is being assessed? Option A, skeletal system only. Option B, integumentary system. Option C, urinary system. Option D, respiratory system. The correct answer is option D, respiratory system. Peak flow measures how quickly air can be exhaled and is related to respiratory function. Peak flow does not measure bone structure. The integumentary system involves the skin, hair, and nails. The urinary system is assessed with urine tests and related procedures. Question 31. After reviewing the situation in a primary care office, a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A, use the parent's estimate if the scale is nearby. Option B, record height only because weight changes often. Option C, round weight to the nearest 10 pounds. Option D, record the measurements using the unit required by the office protocol. The correct answer is option D, record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Estimated weight is less reliable than a measured value. Both height and weight may be needed for clinical assessment. Large rounding errors can create unsafe dose calculations. Question 32. When a patient encounter unfolds in a medication administration visit, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A, alveolus. Option B, platelet. Option C, ureter. Option D, axon. The correct answer is option D, axon. An axon carries nerve impulses away from the neuron cell body. An alveolus is a lung air sac. A platelet is a blood component involved in clotting. A ureter carries urine from kidney to bladder. Question 33. Before the visit continues in a pediatric clinic, the assistant is checking the electrocardiogram standardization mark. Which setting is commonly expected? Option A, 100 mm per millivolt. Option B, 1 mm per millivolt. Option C, 10 mm per millivolt. Option D, 25 mm per millivolt. The correct answer is option C, 10 mm per millivolt. Standard electrocardiogram calibration is commonly 10 mm per millivolt. That value would greatly exaggerate waveform size. That calibration would make complexes appear too small for standard interpretation. That value is not the common standard amplitude calibration. Question 34. While working in a quality control review, a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A. The temperature will be elevated. Option B. The pulse oximetry reading will be inaccurate. Option C. The blood pressure may read falsely high. Option D. The blood pressure may read falsely low. The correct answer is option C. The blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. Cuff size has no direct effect on body temperature. Cuff size does not directly determine oxygen saturation accuracy. A cuff that is too large is more likely to produce a falsely low reading. Question 35. An office review in a preventive care visit shows that a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A. Administer the medication because it was ordered. Option B. Change the medication to another drug independently. Option C. Ask the patient to sign a form and give it anyway. Option D. Hold the medication and notify the provider. The correct answer is option D. Hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. An order does not override a possible allergy. Medical assistants do not independently substitute medications. A form does not make an unsafe medication appropriate. Question 36. While working in an administrative check-in area, a patient is ready for venipuncture and the labels have already printed. Which identification step should be completed before collecting the specimen? Option A. Label the tube after returning to the lab. Option B. Ask the patient to state 2 identifiers and compare them with the order. Option C. Use the room number because it is faster. Option D. Ask a family member to confirm the name only. The correct answer is option B. Ask the patient to state 2 identifiers and compare them with the order. Using 2 approved identifiers before collection helps ensure the right test is performed on the right patient. Delayed labeling increases the risk of specimen mix-ups and rejected samples. A room number can change and is not considered a reliable patient identifier. A family member may be mistaken and one identifier is not enough for positive identification. Question 37. During an internal medicine office, a patient says they cannot afford a prescribed medication. Which response is best? Option A. Notify the provider or appropriate staff so alternatives can be discussed. Option B. Tell the patient to stop all medications. Option C. Ignore the comment because finances are private. Option D. Suggest sharing medication with a friend. The correct answer is option A. Notify the provider or appropriate staff so alternatives can be discussed. Cost concerns affect adherence and should be routed to the care team for appropriate options. Stopping medication without provider guidance can be unsafe. The concern directly affects care and should be addressed respectfully. Sharing prescriptions is unsafe and inappropriate. Question 38. An office review in a telephone triage workflow shows that an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A. Tell the patient that hypertension has been diagnosed. Option B. Send the patient home to rest without notifying anyone. Option C. Erase the value because it may worry the patient. Option D. Recheck using proper technique and report the finding according to protocol. The correct answer is option D. Recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Medical assistants do not diagnose conditions based on one reading. Abnormal readings require appropriate follow-up rather than dismissal. Accurate documentation is required even when the value is abnormal. Question 39. At the start of care in a busy front office, A patient needs crutch walking education after provider instruction. Which principle is important? Option A. Crutches should fit properly and not press into the axilla. Option B. The patient should skip follow-up if pain increases. Option C. Crutches should be used only on wet floors. Option D. Body weight should rest mainly on the armpits. The correct answer is option A. Crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Worsening symptoms should be reported according to instructions. Crutches are mobility aids and wet floors increase fall risk. Weight should be supported through the hands, not the axilla. Question 40. An office review in an exam room shows that a reagent bottle is past its expiration date. Which action is appropriate? Option A. Do not use it for patient testing. Option B. Use it only for abnormal patients. Option C. Change the expiration date on the label. Option D. Mix it with a new reagent to strengthen it. The correct answer is option A. Do not use it for patient testing. Expired reagents can produce inaccurate results and should be handled according to policy. Expired reagents are not reliable for any patient testing. Altering dates is unsafe and unethical. Mixing reagents without approval can invalidate testing. Question 41. Before the visit continues in a medical office workflow, the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A. Appendix. Option B. Thyroid gland. Option C. Urinary bladder. Option D. Gallbladder. The correct answer is option B. Thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The appendix does not produce thyroid hormone. The urinary bladder stores urine and does not produce thyroid hormone. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. Question 42. When a patient encounter unfolds in an urgent care office, a claim requires the code for an office visit procedure or service. Which code set is used? Option A. ICD-10-CM. Option B. Zip code. Option C. CPT. Option D. Policy number. The correct answer is option C. CPT. CPT codes describe medical procedures and professional services. ICD-10-CM codes describe diagnoses and reasons for services. A zip code identifies location and is not a procedure code. A policy number identifies insurance coverage and does not describe the service. Question 43. To protect safety in an infection control audit, a chain of custody urine drug screen is collected. Which practice is most important? Option A. Allow the patient to take the specimen home first. Option B. Document each transfer and maintain specimen integrity. Option C. Skip signatures if the specimen looks normal. Option D. Use an unlabeled container until the lab receives it. The correct answer is option B. Document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Uncontrolled possession breaks specimen integrity. Appearance does not replace custody documentation. Unlabeled specimens can be rejected and cannot be reliably traced. Question 44. The care team in a treatment room asks for guidance because the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A. Hide the incident if there is no bleeding. Option B. Wash the area and report the exposure according to protocol. Option C. Place a bandage on the site and ignore it. Option D. Finish all remaining patients before telling anyone. The correct answer is option B. Wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Covering the wound alone does not address exposure risk. Delaying reporting can delay needed evaluation and follow-up. Question 45. An office review in a primary care office shows that a pain score is being collected during intake. Which approach is best? Option A. Change the score to match the assistant's opinion. Option B. Ask the patient to rate pain using the office's standard scale. Option C. Tell the patient pain is not part of vital signs. Option D. Assume pain level from facial expression only. The correct answer is option B. Ask the patient to rate pain using the office's standard scale. Using a consistent pain scale helps document subjective pain in a comparable way. The pain score should reflect the patient's report. Pain assessment is commonly included in intake workflows. facial expression alone may not reflect the patient's reported pain. Question 46. Before the visit continues in a phlebotomy station, a patient has an irregular pulse during routine vital signs. Which measurement method is most appropriate? Option A, skip the pulse and record not available. Option B, count the pulse for a full 60 seconds. Option C, count for 10 seconds and multiply by 6. Option D, use the patient's previous pulse from the chart. The correct answer is option B, count the pulse for a full 60 seconds. An irregular rhythm requires a full minute count to improve accuracy. The findings should be measured and reported rather than skipped. Short counts are less reliable when the rhythm is irregular. Old values do not represent the current clinical status. Question 47. A medical assistant is working in a cardiology practice when a pregnancy test performed in the office is classified as waived testing. Which requirement still applies? Option A, report results before the test develops. Option B, follow manufacturer instructions and quality control policy. Option C, use expired kits if the package is unopened. Option D, skip controls because waived means unregulated. The correct answer is option B, follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Reading before the correct time can produce inaccurate results. Expired test kits may give unreliable results. Waived status does not eliminate quality responsibilities. Question 48. While working in an infection control audit, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A, use another person's readings if the cuff is shared. Option B, record readings with date, time, and relevant notes as directed. Option C, write only the highest number ever measured. Option D, skip technique instructions because home cuffs are automatic. The correct answer is option B, record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Readings must belong to the patient. Selective recording can mislead clinical decisions. Proper positioning and technique still matter with automatic cuffs. Question 49. For a patient encounter in a patient intake station, a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A, offer water by mouth immediately. Option B, move the patient to a chair before assessing. Option C, activate emergency response and assess breathing according to training. Option D, finish documenting the previous visit. The correct answer is option C, activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Giving oral fluids to an unresponsive patient risks aspiration. Unnecessary movement can cause injury and delay assessment. Documentation should not delay emergency care. Question 50. During a patient intake station, a patient asks about wound care instructions after a minor procedure. Which response is best? Option A, review the provider-approved instructions and confirm understanding. Option B, avoid documenting that instructions were given. Option C, create new instructions that contradict the provider. Option D, tell the patient not to call if symptoms worsen. The correct answer is option A, review the provider-approved instructions and confirm understanding. Medical assistants can reinforce approved instructions and use teach-back to verify understanding. Patient education should be documented according to policy. Instructions should match the provider's plan and office protocol. Patients should know when and how to seek help for concerning symptoms. Question 51. During a treatment room, a pelvic examination is scheduled. Which patient position is commonly used? Option A, Trendelenburg. Option B, Sims. Option C, lithotomy. Option D, a prone. The correct answer is option C, lithotomy. The lithotomy position is commonly used for pelvic examinations. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Sims position is often used for rectal procedures or enemas. Prone means lying face down and is not the common pelvic exam position. Question 52. An office review in a busy front office shows that an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A, open the door to air out the room only. Option B, change only the paper on the exam table. Option C. Clean and disinfect touched surfaces according to office protocol. Option D. Spray disinfectant and wipe it off immediately every time. The correct answer is option C. Clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. Ventilation alone does not remove organisms from contaminated surfaces. The exam table paper does not address other touched surfaces. Disinfectants usually require the manufacturer's contact time to work properly. Question 53. Following office protocol in a quality control review, the provider discusses the function of white blood cells. Which role is most accurate? Option A. Help defend against infection. Option B. Store bile for digestion. Option C. Produce insulin in the pancreas. Option D. Carry oxygen as their primary job. The correct answer is option A. Help defend against infection. White blood cells are immune cells that help protect the body from infection. Bile storage is a gallbladder function. Insulin production occurs in pancreatic beta cells, not white blood cells. Oxygen transport is mainly the role of red blood cells. Question 54. Given the workflow in a cardiology practice, a patient is left without follow-up after the provider terminates care without proper notice. Which legal issue is most likely? Option A. Abandonment. Option B. Coinsurance. Option C. Beneficence. Option D. Assault. The correct answer is option A. Abandonment. Abandonment occurs when care is ended without proper notice or an opportunity to obtain continuing care. Coinsurance is a payment-sharing insurance term. Beneficence means acting for the patient's good. Assault is a threat or fear of unwanted touching, not failure to provide follow-up. Question 55. An office review in an internal medicine office shows that a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A. Update the preferred pharmacy after verifying the new information. Option B. Choose the pharmacy closest to the clinic. Option C. Leave the old pharmacy because it is already in the chart. Option D. Delete all pharmacy information from the record. The correct answer is option A. Update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. The preferred pharmacy should come from the patient rather than staff convenience. Outdated demographic information can delay medication access. Removing needed information can interrupt prescribing workflows. Question 56. A medical assistant is working in an outpatient laboratory when an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A. Patient autonomy. Option B. Beneficence. Option C. Respondeat superior. Option D. Abandonment. The correct answer is option A. Patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Beneficence means acting for the patient's good but does not override a competent refusal. Respondeat superior concerns employer responsibility for employee actions. Abandonment involves ending care without proper notice or support. Question 57. An office review in a treatment room shows that a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A. Use only sterile gloves without a mask. Option B. Place the patient beside an immunocompromised patient. Option C. Apply droplet precautions and offer a mask according to protocol. Option D. Skip precautions if the patient is already taking medication. The correct answer is option C. Apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Sterile gloves do not protect mucous membranes from respiratory droplets. Separating symptomatic patients helps reduce transmission risk. Treatment does not remove the need for appropriate precautions. Question 58. As part of exam preparation in an internal medicine office, a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A. Shake the tube forcefully. Option B. Open the tube and stir with a swab. Option C. Leave the tube unmixed until pickup. Option D. Gently invert the tube the required number of times. The correct answer is option D. Gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Forceful shaking can cause hemolysis and inaccurate results. Opening the tube can contaminate the specimen and expose staph. Failure to mix may cause clotting or poor specimen quality. Question 59. In a same-day appointment, lead V4 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, midway between V2 and V4. Option B, 5th intercostal space at the left midclavicular line. Option C, 4th intercostal space at the left sternal border. Option D, a 4th intercostal space at the right sternal border. The correct answer is option B, 5th intercostal space at the left midclavicular line. V4 is placed at the 5th intercostal space along the left midclavicular line. That location is used for V3 rather than V4. That location is used for V2. That location is used for V1. Question 60. When a patient encounter unfolds in an electronic health record review, a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A, acknowledge the concern and explain the procedure in simple terms. Option B, promise that the provider will not be concerned. Option C, tell the patient the reading is probably wrong. Option D, ignore the anxiety to avoid making it worse. The correct answer is option A, acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Promising an outcome goes beyond the assistant role and may be inaccurate. Dismissing the result can reduce confidence and may be clinically misleading. Ignoring patient concerns can increase anxiety and weaken communication. Question 61. While working in a family practice clinic, a patient is placed lying face down for a back examination. Which position is being used? Option A, Fowler. Option B, prone. Option C, lithotomy. Option D, supine. The correct answer is option B, prone. Prone means lying on the abdomen with the face downward. Fowler is a seated or semi-seated position. Lithotomy involves legs in stirrups for certain pelvic procedures. Supine means lying on the back. Question 62. When a patient encounter unfolds in a treatment room, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A, the assistant's diagnosis before the visit. Option B, demographics, contact information, insurance information, and reason for visit. Option C, only the patient's favorite pharmacy color. Option D, another patient's insurance card. The correct answer is option B, demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. The assistant should not diagnose during scheduling. That information does not complete registration. Insurance information must belong to the patient being registered. Question 63. Before the visit continues in a same-day appointment, the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A, blood pressure and temperature. Option B, pulse and respirations. Option C, height and weight. Option D, oxygen saturation and pain score. The correct answer is option C, height and weight. Body mass index is calculated from height and weight. Blood pressure and temperature do not determine body mass index. Pulse and respirations are vital signs but are not used to calculate body mass index. Oxygen saturation and pain score provide different clinical information. Question 64. At the start of care in a cardiology practice, a patient with limited English proficiency arrives for a consent discussion. Which resource is most appropriate? Option A, skip the explanation if the patient nods. Option B, use a qualified medical interpreter. Option C, speak louder and slower in English only. Option D, ask a young child to interpret. The correct answer is option B, use a qualified medical interpreter. A qualified interpreter improves accuracy, confidentiality, and informed communication. Nodding does not prove understanding or valid communication. Volume does not remove a language barrier. Children should not be used for medical interpretation because accuracy and family dynamics are concerns. Question 65. For a patient encounter in an internal medicine office, the assistant uses a fire extinguisher on a small contained fire. Which acronym describes extinguisher use? Option A, PERLA. Option B, PASS. Option C, HIPAA. Option D, a rice. The correct answer is option B, pass. PASS stands for pull, aim, squeeze, and sweep. PERLA describes pupil assessment. HIPAA governs health information privacy and security. RICE refers to rest, ice, compression, and elevation for certain injuries. Question 66. In a phlebotomy station, the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A, thyroxine. Option B, insulin. Option C, melatonin. Option D, estrogen. The correct answer is option B, insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Thyroxine is a thyroid hormone involved in metabolism. Melatonin is associated with sleep-wake cycles. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Question 67. At the start of care in a pediatric clinic, the medical assistant takes a phone message for the provider. Which information is most important to include? Option A, only the caller's first name. Option B, the assistant's guess about the diagnosis. Option C, a promise that medication will be prescribed. Option D, caller identity, contact information, reason for call, and urgency. The correct answer is option D, caller identity, contact information, reason for call, and urgency. Complete phone messages help the provider triage and respond appropriately. A first name alone may not identify the patient or issue. Diagnosis should not be guessed in a phone message. Medication decisions belong to the provider. Question 68. While working in a same-day appointment, the term gastroenterology appears in a referral. Which specialty is involved? Option A, endocrine glands. Option B, nervous system. Option C, urinary bladder only. Option D, digestive system. The correct answer is option D, digestive system. Gastroenterology focuses on the digestive tract and related disorders. Endocrinology focuses on hormone-producing glands. Neurology focuses on the nervous system. Urology focuses on the urinary tract and male reproductive system. Question 69. During a primary care office, the assistant teaches a patient how to prepare for a fasting laboratory test. Which method best confirms understanding? Option A, ask only whether the patient has any questions. Option B, give instructions as quickly as possible. Option C, use medical jargon to sound professional. Option D, ask the patient to explain the instructions back in their own words. The correct answer is option D, ask the patient to explain the instructions back in their own words. Teach back checks whether the patient understood the instructions and allows correction of misunderstandings. Patients may say no even when they misunderstand instructions. Rushing can reduce comprehension. Jargon can confuse patients and reduce understanding. Question 70. The care team in a phlebotomy station asks for guidance because the assistant speaks with a patient who has hearing difficulty. Which approach is best? Option A, face the patient and speak clearly at a moderate pace. Option B, shout from another room. Option C, cover the mouth while speaking. Option D, assume the patient cannot participate. The correct answer is option A, face the patient and speak clearly at a moderate pace. Facing the patient supports lip reading and clear communication without shouting. Shouting from a distance reduces clarity and privacy. Covering the mouth removes visual cues. Hearing difficulty does not mean the patient cannot understand or decide. Question 71. In a walk-in clinic, a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A, tell the patient to bring personal gloves only. Option B, use latex-free supplies and clearly communicate the allergy. Option C, ignore the allergy if the procedure is short. Option D, use powdered latex gloves because they are easier to put on. The correct answer is option B, use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. The clinic remains responsible for preparing a safe care environment. Even brief latex exposure can cause a serious reaction. Latex gloves can trigger a reaction in a latex allergic patient. Question 72. Given the workflow in a family practice clinic, a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A, red or gold serum tube. Option B, light blue citrate tube for serum. Option C, lavender EDTA tube for serum. Option D, gray fluoride tube for all serum tests. The correct answer is option A, red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. Citrate anticoagulant is used for coagulation testing. EDTA prevents clotting and produces whole blood or plasma, not serum. Gray tubes are not the standard serum tube for routine chemistry panels. Question 73. The care team in a specialty referral visit asks for guidance because an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A, IM. Option B, 4. Option C, subcut. Option D, PA. The correct answer is option D, PA. PA means by mouth and is used for oral administration. IM means intramuscular and refers to injection into muscle. 4 means intravenous and refers to administration into a vein. Subcut means subcutaneous and refers to injection into tissue under the skin. Question 74. At the start of care in a family practice clinic, a patient reports dizziness when standing and the provider requests orthostatic measurements. Which approach is most appropriate? Option A, measure only oxygen saturation while the patient is seated. Option B, have the patient walk quickly before the measurement. Option C, record the first seated blood pressure as orthostatic. Option D, measure blood pressure and pulse in different positions according to protocol. The correct answer is option D, measure blood pressure and pulse in different positions according to protocol. Orthostatic vital signs compare cardiovascular response to position changes. Oxygen saturation does not assess the blood pressure and pulse changes requested. Exertion can distort the readings and increase fall risk. A single seated reading does not show positional change. Question 75. In a medical office workflow, a sterile dressing change is being prepared. Which action helps maintain sterility? Option A, reach across the field with unsterile clothing. Option B, place sterile gauze on an unclean counter. Option C, reuse sterile gloves from a previous patient. Option D, open sterile supplies without touching the inner sterile surface. The correct answer is option D, open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. Reaching over the field can contaminate it. An unclean surface contaminates sterile supplies. Sterile gloves are single-use and patient-specific. Question 76. As part of exam preparation in a same-day appointment, the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A, stop and resolve the discrepancy before proceeding with care. Option B, continue if the last name matches. Option C, use the appointment time as the identifier. Option D, correct the date of birth without asking anyone. The correct answer is option A, stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. A last name alone does not rule out an identity error. Appointment times are scheduling data and are not approved identifiers. Changing demographic data without verification may create a documentation error. Question 77. For a patient encounter in a family practice clinic, a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A, prone. Option B, Sims. Option C, supine. Option D, Fowler. The correct answer is option C, supine. Supine means lying on the back facing upward. Prone means lying face down. Sims position is side lying with one knee flexed. Fowler position is seated or semi-seated. Question 78. After reviewing the situation in an administrative check-in area, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A, leave the patient standing while searching for forms. Option B, tell the patient dizziness is impossible. Option C, assist the patient to sit or lie down safely. Option D, ask the patient to walk faster. The correct answer is option C, assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. An unsteady patient should not be left unsupported. Dismissing symptoms does not protect patient safety. Walking can increase fall risk when the patient is dizzy. Question 79. To protect safety in a phlebotomy station, a mask becomes wet during patient care. Which action is appropriate? Option A, replace the mask according to infection control practice. Option B, keep wearing it for the rest of the week. Option C, share it with a coworker. Option D, dry it on the clean supply shelf. The correct answer is option A. Replace the mask according to infection control practice. A wet mask is less effective and should be changed safely. Extended use of a wet mask is not appropriate. Masks are not shared between staff. Used masks can contaminate clean areas. Question 80. In a medication administration visit, a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A, follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Option B, ignore all provider instructions about inhalers. Option C, wear tight clothing that restricts breathing. Option D, eat a heavy meal immediately before every test. The correct answer is option A. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. Medication instructions should follow the provider or testing protocol. Restrictive clothing can interfere with respiratory effort. A heavy meal may interfere with comfortable breathing for some tests. Question 81. Given the workflow in a busy front office, the provider asks for the chief complaint before entering the room. Which documentation is most appropriate? Option A, ear infection diagnosed today. Option B, patient reports sharp right ear pain for 2 days. Option C, right ear normal after exam. Option D, patient seems dramatic about ear pain. The correct answer is option B. Patient reports sharp right ear pain for 2 days. The chief complaint should be documented as the patient's main reason for the visit in clear, concise wording. A diagnosis should not be documented by the assistant unless the provider has made it. Exam findings belong to the provider and are not the chief complaint. Subjective judgment is unprofessional and not appropriate for the medical record. Question 82. While working in a women's health clinic, soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A, alcohol sanitizer is always illegal in clinics. Option B, hand washing is needed only before eating. Option C, soap and water help remove spores more effectively from the hands. Option D, gloves completely replace hand hygiene. The correct answer is option C. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Alcohol-based hand rubs are appropriate for many routine situations. Hand hygiene is required at multiple points in patient care. Gloves reduce exposure but do not replace hand hygiene after removal. Question 83. For a patient encounter in a medication administration visit, the provider asks the assistant to perform a task prohibited by state law. Which action is appropriate? Option A, ask another assistant to do it secretly. Option B, perform it because any provider request is automatically legal. Option C, document that the patient requested it and proceed. Option D, clarify the concern and follow legal scope of practice requirements. The correct answer is option D, clarify the concern and follow legal scope of practice requirements. Medical assistants must follow laws, regulations, and employer policy even when working under delegation. Passing on an improper task does not resolve the legal issue. Delegation does not make a prohibited task legal. Patient request does not override scope of practice limits. Question 84. When a patient encounter unfolds in a community health clinic, a patient feels faint during a blood draw. Which response should occur first? Option A, leave the patient alone to find paperwork. Option B, finish filling the tube before responding. Option C, stop the procedure and protect the patient from injury. Option D, tell the patient to stand up quickly. The correct answer is option C, stop the procedure and protect the patient from injury. Safety comes first when a patient shows signs of syncope during venipuncture. A faint patient should not be left unattended. Continuing the draw can worsen the situation and increase injury risk. Standing can worsen faintness and lead to a fall. Question 85. To protect safety in an outpatient laboratory, a used needle must be discarded after an injection. Which practice is safest? Option A, carry the needle to the front desk for disposal. Option B, activate the safety device and place the needle in a sharps container. Option C, place the needle in regular trash. Option D, recap the needle with both hands. The correct answer is option B. Activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Transporting exposed sharps through the office increases risk. Sharps can injure staff and must not go into regular trash. Two-handed recapping increases needle stick risk. Question 86. Following office protocol in a preventive care visit, a provider orders spirometry in the office. Which patient action is required? Option A, talk continuously during the maneuver. Option B, remove the mouthpiece before starting. Option C, hold both nostrils and refuse to exhale. Option D, follow instructions for a strong, complete breathing maneuver. The correct answer is option D, follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. Talking interferes with airflow measurement. The mouthpiece is needed to measure airflow. The test depends on controlled breathing through the device. Question 87. At the start of care in a preventive care visit, a wet floor is noticed near the reception desk. Which action best prevents injury? Option A, cover it with loose papers. Option B, ignore it because it is not in an exam room. Option C, wait until a patient reports slipping. Option D, place a warning sign and arrange cleanup immediately. The correct answer is option D, place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Loose paper can worsen slipping and does not clean the hazard. Safety hazards matter throughout the facility. Prevention should occur before an injury happens. Question 88. At the start of care in a walk-in clinic, a patient asks why a medication is placed under the tongue. Which route is being described? Option A, topical. Option B, otic. Option C, sublingual. Option D, ophthalmic. The correct answer is option C, sublingual. Sublingual administration places medication under the tongue for absorption through oral mucosa. Topical medications are applied to the skin or surface tissues. Otic medications are placed in the ear. Ophthalmic medications are used in the eye. Question 89. At the start of care in a clinical skills review, a provider orders a capillary blood glucose test. Which site preparation is important? Option A, puncture through visible dirt. Option B, skip patient identification because the test is quick. Option C, use the first visibly dirty drop for every test. Option D, clean and dry the puncture site according to protocol. The correct answer is option D, clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Contamination can affect the sample and infection risk. Patient identification is required even for quick point-of-care tests. Site contaminants can affect the first drop depending on protocol. Question 90. An office review in an electronic health record review shows that a patient is crying after receiving difficult news from the provider. Which nonverbal behavior is supportive? Option A, keep checking messages during the conversation. Option B, stand over the patient with crossed arms. Option C, sit at eye level and allow silence when appropriate. Option D, laugh to lighten the mood immediately. The correct answer is option C, sit at eye level and allow silence when appropriate. Calm presence, appropriate eye level, and respectful silence can support a distressed patient. Distracted behavior suggests the patient is not being heard. Closed posture and standing over the patient can seem intimidating. Humor can be inappropriate when a patient is distressed. Question 91. As part of exam preparation in an electronic health record review, a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A, lie flat immediately without assessment. Option B, sit upright and lean slightly forward. Option C, tilt the head far backward. Option D, pack the nose with contaminated gauze. The correct answer is option B, sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood while upright posture can reduce pressure. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Tilting backward can cause blood to drain into the throat. Contaminated materials should not be inserted into the nose. Question 92. As part of exam preparation in a busy front office, the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A, count respirations while the patient is unaware of the measurement. Option B, count for 5 seconds and multiply by 12. Option C, ask the patient to breathe as deeply as possible. Option D, record the respiratory rate from the last visit. The correct answer is option A, count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Very short counts are often inaccurate for respirations. Deep breathing changes the normal respiratory rate and effort. Current respirations must be measured during the encounter. Question 93. For a patient encounter in a primary care office, the assistant reinforces instructions for a Holter monitor. Which point is important? Option A, ignore the return time. Option B, keep a diary of symptoms and activities as instructed. Option C, remove electrodes whenever symptoms occur. Option D, submerge the monitor in water. The correct answer is option B, keep a diary of symptoms and activities as instructed. A symptom and activity diary helps correlate events with the recorded rhythm. The monitor must be returned as scheduled for data review. Removing electrodes can interrupt recording when data are most important. Water can damage the device and create safety risks. Question 94. For a patient encounter in a phlebotomy station, a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A, ask respectful questions and avoid judgment. Option B, assume all people from that culture act the same. Option C, refuse to document relevant information. Option D, tell the patient the practice is foolish. The correct answer is option A, ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Stereotyping ignores individual differences. Relevant patient information should be documented according to policy. Judgmental language damages trust and may prevent disclosure. Question 95. An office review in an administrative check-in area shows that a medical office uses a policy and procedure manual. Which purpose is most accurate? Option A, replace all state laws. Option B, guarantee every claim is paid. Option C, provide standardized guidance for office tasks. Option D, eliminate the need for training. The correct answer is option C, provide standardized guidance for office tasks. Policies and procedures help staff perform tasks consistently and safely. Office policy cannot override applicable law. Policies do not guarantee pay or reimbursement. Policies support but do not replace staff training. Question 96. While working in an electronic health record review, an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A, give oral medication before checking responsiveness. Option B, use the defibrillator on a conscious patient asking questions. Option C, begin CPR and use the automated external defibrillator as directed. Option D, wait for the provider before starting any response. The correct answer is option C, begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. Oral medication is unsafe when cardiac arrest is suspected. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Delaying basic life support can reduce survival. Question 97. To protect safety in a same-day appointment, a patient requests an appointment reminder by text message. Which consideration is important? Option A, text any diagnosis to any phone number in the chart. Option B, ignore all reminder preferences. Option C, follow office policy and patient communication preferences. Option D, post the reminder on social media. The correct answer is option C, follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Sensitive information and wrong numbers can create privacy risk. Preferences help guide appropriate communication. Public posting would expose private information. Question 98. A medical assistant is working in a medication administration visit when a patient with diabetes is scheduled for fasting laboratory work. Which action is appropriate? Option A, tell the patient to stop all diabetes medications without provider input. Option B, review fasting instructions and route medication questions to the provider. Option C, cancel the test because diabetes always prevents fasting labs. Option D, tell the patient fasting means no restrictions at all. The correct answer is option B. Review fasting instructions and route medication questions to the provider. Fasting instructions can be reinforced, while medication adjustments require provider guidance. Medication changes can be unsafe without provider direction. Diabetes requires careful instructions but does not automatically cancel testing. Fasting usually includes specific limits on food and drink. Question 99. Following office protocol in a clinical skills review, the provider mentions the largest artery in the body. Which vessel is being described? Option A, aorta. Option B, vena cava. Option C, pulmonary vein. Option D, carotid vein. The correct answer is option A, aorta. The aorta is the main artery carrying blood from the left ventricle to systemic circulation. The vena cava is a large vein returning blood to the heart. Pulmonary veins return blood from the lungs to the heart. Carotid structures are in the neck, but the carotid artery is not the largest artery. Question 100. A medical assistant is working in a patient education session when the assistant is reviewing the function of red blood cells. Which role is most accurate? Option A, filter lymph. Option B, produce bile. Option C, transport oxygen. Option D, create antibodies as their main role. The correct answer is option C, transport oxygen. Red blood cells contain hemoglobin, which carries oxygen to tissues. Lymph nodes filter lymph rather than red blood cells producing this function. Bile is produced by the liver and stored in the gallbladder. Antibody production is associated with certain white blood cells and plasma cells.